Seniors, beware. 9 popular medications that trigger rapid dementia. Did you know that some of the most common medications prescribed to seniors, the same ones sitting right now in your bathroom cabinet, could actually be speeding up memory loss and cognitive decline? Studies show that certain pills taken daily by millions of older adults can mimic the symptoms of dementia, causing confusion, forgetfulness, and foggy thinking that's often mistaken for aging. Today, we're exposing the 9 most common medications linked to rapid cognitive decline, so you and your loved ones can take control before it's too late. Let's get into it, because knowledge isn't just power, it's protection. Antihistamines. You might know them as allergy pills, the ones you reach for when spring pollen hits or your nose won't stop running. But here's the catch. Many over-the-counter antihistamines, especially older ones like diphenhydramine, can block a vital neurotransmitter in your brain called acetylcholine. This chemical keeps your memory, focus, and learning sharp. When it's blocked, the brain starts to slow down, literally acting as if it's aging faster. Experts have even linked long-term use of these medications to a higher risk of dementia. Some people feel groggy or foggy after taking them, but most brush it off as normal. It's not. If you're relying on allergy medication daily, it's time to talk to your doctor about safer alternatives that don't cloud your mind. Sleep aids. We've all had those restless nights, staring at the ceiling, desperate for sleep, and that's when many people turn to sleeping pills. But here's the problem. Most sleep aids, both prescription and over-the-counter, work by slowing brain activity, and over time, that constant shutdown can make it harder for your brain to recover and stay sharp. Medications containing diphenhydramine or doxylamine are especially risky for seniors, as they cause next-day drowsiness, confusion, and memory issues. What's worse, when the brain doesn't enter its deep natural sleep cycles, it loses its ability to clean out toxins, including the ones linked to dementia. If you've been using sleep medication regularly, try natural alternatives like magnesium, melatonin, or gentle bedtime routines that help your brain rest, not shut down. Antidepressants. Antidepressants are among the most prescribed drugs for older adults, and while many can be life-changing, some come with a dark side. Certain types, especially tricyclic antidepressants, can interfere with neurotransmitters that regulate mood and memory. Over time, this interference can make seniors feel slower, forgetful, or emotionally flat. The real danger comes when these symptoms get misdiagnosed as early dementia. The tragedy? Many patients stop trusting their own minds, when it's actually the medication dulling their clarity. If you or someone you love is on antidepressants and noticing unusual cognitive changes, never stop cold turkey. But do speak to your doctor about switching to safer, modern options that protect both mental health and memory. Anti-anxiety medications. Benzodiazepines, often prescribed for anxiety or panic, are some of the most dangerous for the aging brain. Drugs in this category can make you calm and sleepy, but they also slow your brain's ability to form new memories. Studies have shown that long-term users have a significantly higher risk of developing dementia, even years after they stop taking them. They're effective in emergencies, but risky when used daily. The real kicker? The brain becomes dependent on them quickly, meaning when you try to stop, anxiety can come roaring back. Instead of masking anxiety with medication, talk to your healthcare provider about non-addictive alternatives like cognitive behavioral therapy or natural relaxation supplements that don't sabotage your mind. Antipsychotics. These medications are often given to treat mood disorders, agitation, or even sleep issues in older adults, but they're among the most alarming when it comes to brain health. Antipsychotics can drastically alter brain chemistry, suppressing dopamine and serotonin, the very chemicals that keep your mind active and your mood stable. Long-term use can lead to confusion, sluggish thinking, and a frightening loss of awareness that mimics dementia almost perfectly. Some care facilities even use these drugs to calm patients with memory problems, but in reality, it may only worsen their condition. If a loved one has been prescribed an antipsychotic for behavior or sleep, it's critical to question why, and ask about non-drug options that don't sacrifice cognitive function. Pain medications. Chronic pain can be unbearable, And for many seniors, painkillers seem like the only relief. But opioids and even some over-the-counter pain medications can have devastating effects on the brain when taken regularly. Opioids slow brain signaling, dull emotions, and weaken short-term memory, which is why long-term users often describe feeling detached or mentally foggy. Even common pain relievers taken daily in high doses can affect blood flow to the brain, reducing clarity. Pain management is important, but it's time to think beyond pills. Physical therapy, gentle exercise, and anti-inflammatory foods can reduce pain without harming your memory. Your brain deserves that relief too. Bladder control medications. Now here's a category most people never suspect: bladder medications. These drugs, often prescribed for overactive bladder or urinary incontinence, contain anticholinergic compounds that block signals between nerves and muscles, including the nerves in your brain. The result? Foggy thinking, trouble concentrating, and confusion that can set in within weeks of starting. The cruel twist is that these symptoms are often blamed on age, not the medication. But the moment patients switch or stop under medical supervision, their clarity often returns. If you're on bladder medication and noticing any cognitive changes, it's worth bringing up to your doctor. Sometimes a small switch can mean getting your sharp mind back. Heartburn and acid reflux medications. They promise instant relief from heartburn, but long-term use of certain acid reflux medications can come at a hidden cost. These drugs reduce stomach acid, which sounds good, but stomach acid is essential for absorbing vitamin B12, magnesium, and other nutrients that protect the brain. Low B12 levels are directly linked to memory loss, confusion, and even depression. So while your heartburn might disappear, your brain could be starving for the nutrients it needs to function. If you've been taking acid reflux medication for months or years, talk to your healthcare provider about weaning off safely or supplementing with the right nutrients to protect your memory. Blood pressure medications. Finally, we reach one of the most prescribed categories of all: blood pressure medications. Now, not all are harmful, many are life-saving, but certain ones, especially beta blockers, can cross into the brain and slow down your nervous system, leading to fatigue, slower thinking, and sometimes depression-like symptoms. It's a delicate balance, keeping your heart healthy without dimming your mind. The solution isn't to stop, but to stay aware. If you notice memory issues or mental fog after starting or changing a medication, always speak up. Adjusting the type or dosage can make all the difference between feeling cloudy and feeling clear. If you found this video helpful, hit that like button to support the channel, subscribe for more senior health insights, and share this with someone you love. Because protecting your mind starts with understanding what's really inside those pills. And tell me in the comments, which of these surprised you the most? Your awareness today could be the reason someone keeps their memories tomorrow.